Now, the late Ken Okoth was a warrior who battled colorectal cancer for years. Here's what you need to know about this type of cancer. Colorectal cancer is among the top 10 cancers in Kenya. It starts in the bowel area, that is in the colon or rectum, otherwise known as the large intestine. Cells in the lining of the colon or rectum can change or grow and become cancerous. The symptoms can be subtle, but more obvious symptoms are blood in the stool, persistent and more frequent passing of stool and loose stool as well, and abdominal pain. These symptoms can also, however, be common and do not necessarily mean one has bowel cancer. Those more at risk of colorectal cancer are people over 50 years of age, but there are younger sufferers too, as of course Ken Okoth was 41 years old. A diet high in red or processed meat and low in fiber, overweight people, those who smoke and drink in excess and fail to exercise are also at higher risk. Family history of the cancer or other underlying conditions can also cause the disease. Surgery or chemotherapy and radiotherapy are the ways in which the cancer can be treated but not necessarily cured, and especially if it gets to the latter stages such as the one that Ken Okoth was suffering from, stage 4. And there are ways in which one can try to prevent cancer. That's by undergoing bowel screening, maintaining a healthy, balanced diet and weight, and by living a healthy lifestyle devoid of excess smoking and alcohol consumption.